This is the first picture of the how you do the cataract surgery. Let us know about something about the lens, how the lens develops. The lens develops from the surface ectoderm of the fetus at the 6th week of gestation. The cells elongate to form the fibers and arrange in the zones. The central nucleus consists of older cells and peripheral consists of the younger cells. The peripheral cells, they develop into the cortex. The fiber of the central embryonic nucleus meet around the Y-shaped sutures. Outside the embryonic nucleus, successive nuclear zones are developed. So, in the center there is nucleus, and then there is successive zones, and cortex, and the capsule. So, these are the different parts of the lens. The lens is biconvex. At first it is 65 gram. When the person reaches 30 years, it becomes 258 gram. The granules are attached to the ciliary bodies. The lens is composed entirely of the epithelium surrounded by the capsule. The capsule, the collagen basement membrane, they are the transparent structures. The lens epithelium single layer cells, central cells do not divide actively, whereas the peripheral cells divide actively. As the cells elongate, they lose the nucleus and form the fiber-like structure. The older fibers are pushed centrally, peripheral cells superficially. The substance of the lens divided into central nucleus, peripheral cortex. The nucleus has higher refractive index than the cortex. The anterior capsule consists of cells, whereas the posterior capsule have lost the cellular structures. Metabolism. The cells of the lens are interconnected by the gap junctions by the desmosons, but not by the zona occludentis as in other cells. The ions and metabolites of the low molecular weight can be exchanged through the capsule of the lens. The epithelium transports the sodium, potassium, and ATPase, calcium, activated ATPase, and other electrolytes. The active transport of amino acids also occurs, and glucose is also transported in the lens. These all electrolytes, they are transported from the aqueous humor, which is the source of energy, and the metabolism, which mostly occurs in the cortex of the lens. The metabolic pathway in the lens, they are the glycolysis, which is also known as Embden-Mayer pathway, or that is the anaerobic pathway, through which 70 to 80% of ATPase, they are received. Second is the pentose pathway. Next is the aerobic pathway in the lens epithelium, which occurs 3 to 25% ATPase are liberated. And next is the sorbitol pathway, which occurs in diabetes. So altogether, there are 4 pathways in the lens, 3 in the normal case and the 4 in the diabetic patients. Glycolysis, it may be asked in the exam also. The measure of the ATPase that is liberated from the glycolysis. And the second is the aerobic pathway, through the 3 to 25%. And pentose pathway and sorbitol pathway. The transparency of the lens is maintained by the regular arrangement of the lens fibers. The lens fibers, they are regularly arranged in the lens. So this keeps the lens transparent. Any factor which increases the absorption or scattering of the light by the lens reduces transparency. If there is changes in the metabolisms, that causes the scattering of the light and the lens loses the transparency. etiology of the cataract, etiopathogenesis. Degeneration and opacification of the lens fibers. There is deposition of other materials in the lens fibers, disturbance of the intra and extra components of the water and electrolytes, rearrangement of the collateral systems of the fibers, formation of the aberrant lens fibers, fibrous metaplasia, and epithelial cell necrosis, opacifications, glaucoma flecans as it occurs in acute congestive glaucoma, and abnormal metabolism produces deposition of the Fabry disease, storage, Wilson disease, copper storage, and cirrhosis toxic reaction due to iron deposition. So there are different factors which help to form the cataract. Biochemistry. Changes of semi-permeability of the lens capsule. Hydration due to osmotic changes as it occurs in the traumatic cataract, and denaturation of the lens protein, so that increases the insoluble proteins, and this insoluble protein, they are dense and they cause opacity. They form the lens. They form the hard cataract. Precipitating factor. As the age advances after 40 in the Tarai or 50%, 50 years in hills, these all factors, they are aggravated and form the cataract. Geography. Tropical areas are more. Narani zone, they have the more frequency of the cataract in Nepal. Cigarette smoking. The cyanide which is present in the cigarette precipitates the formation of the black cataract. Trauma, which changes the metabolic activity and causes the cataract. And the radiation injury, any radiation which is given for any the tumor in the facial area, that can cause the cataract. Or some explosions, radiation energy explosion, that also causes the cataract earlier. Next is the 6 Ds. Drugs like myotics, organophosphorus, thalidomide, steroids, amiodarone, busulfan, chloroquine. These are the drugs which precipitate the formation of the cataract. If you remember the 6 Ds, that is easier. Daylight. Those persons which are exposed in the daylight for the day-to-day work, the ozone layer of the atmosphere is becoming deficiency, so that the ultraviolet rays of the sun is coming, is penetrating, and that causes the cataract. Dirty worker, those who work in the sewage or nala बनाउने कामहरुमा जो काम गर्छन्, dirty worker, they are also exposed more to the sunlight, and that also causes the cataract earlier. Dysentery, chronic dysentery, patients who are suffering from the chronic dysentery, there the metabolic changes that leads to the formation of the cataract earlier. Diabetes, the glucose which is present in the blood, as well as the glucose percentage also increases in the lens, and that causes the osmotic imbalance and causing the cataract earlier. And some deficiency of the tryptophan, amino acid, riboflavin, vitamin A, calcium, these are also the precipitating factor which cause the cataract. Symptoms. As the person develops the cataract, the patient complains the gradual diminishing vision. Since 6 months or 1 or 2 years, the person is having the diminished vision. बिस्तारै देख्न कम भयो भनेर आउँछ. Gradual diminished vision. Blurring of vision. कुनै चीज हेरेको छ भने प्रष्ट देखिँदैन. Blurring of vision. And white opacity. If someone sees in the eyes, you can see the white opacity in the lens. And person usually changes the glasses frequently. As he has no good vision, so he changes the glasses frequently. Sometimes there is diplopia or polypia. One has its different objects or 2 objects. diplopia due to irregular astigmatism and multiple wounds. They are also seen in due to polypia when the patient develops the cataract. Color halos. Patients is better in the dim light in nuclear sclerosis, and this is also better in daylight in cortical cataract. The patient can see better near due to the nuclear sclerosis. When the person develops the cataract, which a nuclear sclerosis type of cataract, then the patient has the good vision for the near vision. The sign of reduced vision for the far. You can see the iris shadow in case of image cataract, white opacity behind the pupil, and other sign are if you focus the retinoscope, you can see some clear area in immature cataract, whereas in the mature cataract you cannot see some clear area, and some useful vision is present in the immature cataract, whereas in mature cataract there is no useful visions. You have to differentiate the cases of cataract with other causes where there is gradual diminished vision. So differential diagnosis of gradual diminished visions, they are the mature senile cataract, glaucoma, macular degeneration, optic atrophy. These are the causes where there is gradual diminished vision. Classification of a cataract. Cataract can be classified in different terms like congenital and acquired according to the age related, congenital, developmental, senile, and morphological, subcapsular, cortical, and nuclear. Hello? म 1 बजे पौने 1 बजे आइपुग्छु त्यहाँ है 1 बजेमा आइपुग्छु 15-20 मिनटपछि म आइपुग्छु Traumatic. The trauma are also different types: direct penetrating injury, concussions, or electric shock, lightning, and the radiation. These are the different varieties of the trauma which also can cause the cataract. So, according to the etiology, cataract is also classified into different types. Metabolic cataract. Diabetes mellitus. In diabetic mellitus, there is osmotic imbalance, there is overhydration of the lens protein, and opacification also occurs, and the snowflakes opacities or punctate opacities are seen in diabetes. Galactosemia, deficiency of the galactose, 1-phosphate or uridyl transferase. There is central oil droplet cataract is seen in galactosemia, and this is autosomal recessive condition. Galactokinase deficiency, it is also autosomal recessive condition which occurs in children and shows the lamellar type of cataract. Monosodidosis, deficiency of alpha monosidase, and Fabry's disease, deficiency of alpha galactoside. Loeys disease, which is characterized by the mental deficient, renal dwarfism, osteomalacia, muscular hypotonia, frontal prominence, and the cataract, Loeys disease, and hypocalcemia. These are the different metabolic diseases where the cataract can occur. Toxic cataract. Person who is taking steroids in systemic disease as well as in ocular disease for the prolonged times, they can develop the cataract. If more than 10 grams of prednisolone is taken daily for 1 year, such person can develop the cataract, usually the posterior subcapsular cataract. Children suffer more than the adult, and chlorpromazine, fine yellow deposition, anti-lamellar cataract, myotics, pilocarpine, which is used in the glaucoma, that also causes the cataract earlier. Busulfan and myelin, which is used in chronic myeloid leukemia, that also causes the cataract. Amiodarone, which is used in cardiac arrhythmias, it can cause the cataract as well as there is opacity in the cornea, which looks like the vorticella. And the gold, which is given in the rheumatoid arthritis, if it is given more than 3 years, 50% they develop the intracapsular cataract. So these are the different types of toxic cataract. Secondary cataract, which occurs in chronic anti-uveitis, retinitis pigmentosa, high myopia, acute congestive glaucoma. These are the cases where the secondary cataract are seen. Congenital cataract, intrauterine causes. Congenital cataract, usually most of the common is the rubella virus infection. 50% rubella virus crosses with the lens capsule, can remain in the lens up to 3 years and cause the cataract. Next is toxoplasmosis, cytomegalovirus, and maternal drug intake, thalidomide and steroid. These are the cases which can cause the congenital cataract. Now we can see the cataract in this case here. It might be the case of the traumatic cataract. This is the baby where you can see the white opacity behind the pupillary area. Pre-senile cataract, which if the cataract occurs before 40 years and after 20 years, this is not the pre-senile cataract, which usually occurs in myotonia dystrophy, atopic dermatitis, Down syndrome, Werner syndrome. These are the cases where the pre-senile cataract can be seen. Now the both eyes, they have the cataract in this child. Now we can see there is polar cataract, means you can see the cataract posteriorly. In cortex and between there is a clear area. Now we can see the posterior polar cataract and homogeneous opacity in the cortex. Now we can see the yellow, golden yellow reflex in the posterior part of the lens, which is usually due to the posterior segment disease like retinitis pigmentosa. This is the dot-like cataract which are seen in this case, as occurs in rubella. Hereditary cataract. 1/3 congenital cataract are hereditary and they are autosomal dominant. According to maturity, the cataract also classified as immature cataract, mature cataract, hypermature cataract, intimation cataract, that is swollen by the imbibing waters, and Morgagnian cataract, total liquefaction of the cortex, nucleus, and sinks in squarely. This is Morgagnian cataract. So, according to maturity, the cataract is classified in different types. Developmental cataract may be present at birth. It may be congenital also, may develop later in the life. Many variegated forms they are seen, common with the minor manifestations, minute opacity seen after the full dilatation of the pupil, particular zones is affected with the metabolic disturbances. Now look at these pictures. In the first, there is no uniformity. In some places, usually anterior and posterior capsule, there is cataract ascent. In the posterior pole also, there is cataract ascent. In other, there is thick cataract. Now we can see in this picture, there is dot-like opacity in the lens. There is a ring-like opacity in this case. Here you can see the cataract, different types. At the center there is cataract, periphery is clear. In this case, the central there is cataract, periphery is clear. So there are different varieties of cataract. Congenital cataract, which are due to two types, maternal cause and fetal cause. The maternal cause are due to the rubella infection, deficient oxygenation into placental hemorrhage, hypokalemia, diabetes mellitus, galactosemia, vitamin A deficiency, and extra drug intake. These are the causes which can cause the cataract in baby if they are present in the mother. Fetal causes of the rubella, trauma, vitamin A deficiency, metabolic causes, and hereditary. Investigation of congenital cataract. Examination of the density of the cataract using direct and indirect ophthalmoscope. Associated ocular pathology should be studied: cornea clouding, microphthalmos, glaucoma, persistent hyperplastic primary vitreous, rubella retinopathy, choroiditis, and foveal hypoplasia. Inspection. Whether patient can fix his eyes or not, whether he has the nystagmus to and fro movement of the eyeball or not, if he has the squint strabismus, you should record the visual acuity in children to the card test, series of cards, or preferential looking, or card for drum, or it can be detected by the visual echo response like VER and VEP also. Test. You can test for the serological test like for the rubella, platelet count for the thrombocytopenia, calcium phosphate, or hypoparathyroidism also. You can detect the cataract in diabetes patient by the bendy test of the urine, and urine also chromatography of the amino acid for the lowest digits, and X-ray is called for calcification of the basal ganglia in hypoparathyroidism. So these are the different tests which can be done to detect the cause of cataract. Management of congenital cataract. Both are advanced cataract, it requires the surgery. Both are immature cataract can be delayed. Unilateral cataract extraction earlier is necessary, and then you manage for the aphakia. Surgical technique, lens aspiration in children, make him aphakic, and secondary IOL you can plan later on under the J anesthesia. If all the facilities are present in the hospital, then you can plan for the lensectomy, PCIOL under general anesthesia. You can correct the aphakia with the +10 diopters, and later you can give the contact lens or secondary IOL or EP keratoplasty. This can be done in different cases. Age-related cataract. For the evaluation of the age-related cataract, you should know the visual acuity, perception and projection of the light. Projection of light shows the optic nerve is intact. Perception of light shows the retina is intact. Pupillary reaction. If there is pupillary reaction, it indicates the optic nerve is intact. If the pupillary reaction is absent, optic nerve is damaged. Color vision. You should see the primary color, red, green, and yellow color. Red color that denotes that the optic nerve is intact. Green and yellow denotes the retina is intact. Fundus, you should evaluate the fundus after dilating the pupil, and you can do the interruptive phenomenon. In the interruptive phenomenon, ask the patient to close the eyes and light the torch, putting on the eyelids. If the patient can see red blood corpuscle flowing, and then the interruptive phenomenon is normal. It denotes that the retina is intact. And 2-point discrimination test. Make the 2 points in a cardboard about 2 millimeter apart and keep it at 2 feet. Whether the patient and show the torch. If the patient can detect the 2 lights, then 2-point discrimination test is positive. Next instrument, interferometry and VR or VEP. These are other instruments which can detect or give you about the clue about the cataract. And this is a case of a mature cataract. Mature cataract. Preoperative evaluation of systemic disease. Before doing the cataract operation, the management of the cataract is operation. When the patient has difficulty for the day-to-day activities, according to his words, then one should advise him for the cataract operation. Before doing the cataract surgery, you should evaluate his blood pressure, whether the patient blood pressure is normal or not. If patient is hypertensive, then you should control first hypertension, then only you advise for the cataract surgery. Similarly, diabetes should be controlled before cataract surgery, bronchial asthma, bronchitis, benign prostate hypertrophy, and Parkinsonism. These are the systemic conditions which you should evaluate and manage before doing the cataract surgery. Evaluation of ocular condition. Whether the cataract is hypermature, mature or immature, or dislocated or subluxated. Dislocated means if the lens is not in position in the visual axis, this condition dislocation. The dislocation may be the anterior or posterior. If it is subluxated in the anterior chamber, it is anterior dislocation. If it is dislocated posteriorly in the vitreous, it is posterior dislocations. Subluxation means the cataract is in the visual axis, but it is subluxated, means the zonules are loose and they are separated from the lens. Few fibers are present. So this is the subluxated. With the patient has, and the types of cataract also, hard cataract and soft cataract. These are the cases when there is dislocation of the cataract or subluxated, hard cataract, then one should have the difficulty while doing the cataract surgery. Glaucoma, whether glaucoma is controlled or not. If the glaucoma is not controlled, then the complication can arise during the surgery. Vitreous loss can occur if the glaucoma is not controlled. Uveitis. If we do the cataract surgery, in uveitis case, the uveitis should be a flare-up. And optic condition, retinal condition, and macular condition you have to evaluate before doing the surgery. The history of cataract surgery. The Sushruta was the first man who has done the first surgery. He was from the India in the ancient time where he has started the cataract surgery. Then when the Alexander they invade the India and he cannot go east from the India, he returned from India. When he returned to Europe, many learned persons they have returned from India to Europe. And those learned persons they told us about the Ayurveda and Sushruta's teachings. And his method was followed, Sushruta's methods of practice in the Europe. And they started when one surgeon of the friends he cannot do the Sushruta's methods, then he started giving the incision in the limbus and extracted the lens. Then this intracapsular lens extraction was started. And extracapsular lens extraction also extracted. In this case, the posterior capsule is left behind and the IOL is implanted. Heraldedly, in 1947, he started the lens and put the intraocular lens since 1947. Now another modified form is the SICS, spontaneous incision cataract surgery. This process was practiced by the Henning in the Sagarmatha Chaudhary Hospital in Nepal. Later, Dr. Ruiz also practiced these methods, and this method is becoming the familiar nowadays. Now the phacoemulsification, in this case, the instrument is inserted in the antechamber and the lens is extracted by the phacoemulsification. Now later the laser emulsification is also coming. So these are the different methods. This is a short history of the cataract surgery. Operation can be done by the retrovalvular block and the fissure block, paravalvular block, local infiltration, and under general anesthesia. While preparing the patient, some complication can arise. Galilean reaction, retrovalvular hemorrhage, perforation of eyeball can occur. These are the preoperative complications. Anxiety, rise of blood pressures. Operative complications like disinsertion of the superrectus, iridodialysis, sphincter rupture, lens dislocation, subluxation, posterior capsule rupture, vitreous hemorrhage, suprachoroidal hemorrhage, high fever, pupillary block, and wind leak. These are the operative complications of the cataract surgery. Post-operative complication, iris prolapse, suture rupture, wound leak, endophthalmitis, which can occur in 1 in 1,000. Sunset sign means dislocation of the lens, sunset and sunrise signs. Corneal edema due to the endothelial loss, cystoid macular edema, retinal detachment, vitreous hemorrhage, and chronic endophthalmitis. These are the post-operative complications of the cataract surgery, which you should be familiar. In the examination, the viva, these are the complications which are asked with each student. Abnormalities of the lens shape and position. Sometimes we can see the lens coloboma, posterior lenticoconus or anterior lenticoconus, lentiglobus, microphakia, or microspherophakia. These are the different abnormal lens shape and size of the lens. There are some conditions. Ectopic lenses, 2 types. Aqua type means if the lens is not in positions, it may be due to the trauma, high myopia, anterior tumor, ophthalmos, hypermethyl cataract. In hereditary cases like Marfan syndrome, Weill-Marchesani syndrome, homocystinuria, and aniridia. These are the conditions where the lens is not in the position. This finishes the cataract.